my boss just bought one and said, here, use it. Let's talk about air polishing. Some of you might be already using it, and some of you might be super curious, going, what is this and is it worth it? And I must say, I was a bit like you. I had been practicing as an oral health therapist for 15 years, and I'm thinking, why change? Everything's fine the way it is. How much better could this new machine be? So I kind of had no choice but to figure it out. But to be honest, I'm so glad that he bought it, because it has completely transformed my experience doing dental hygiene for patients. It made me more efficient, it made me more gentle, more informative, and less fatigued. Let me tell you how. Using the air polishing machine, I became so much more efficient. I was able to halve the amount of time I needed to perform dental hygiene appointments. I was able to see double the number of patients. Before that, I was using traditional methods, which took me about 40 to 60 minutes per appointment, and I thought that was normal. But of course, with this machine, I became so much faster. My patients were happier, they could see me sooner, no one was waiting 3 months to see me. My boss was happy and I was happy. So that's in terms of efficiency. The next thing is this machine is so much more gentle. My patients are absolutely loving their hygiene appointments, believe it or not. Even the ones that are so sensitive that they're afraid to come to the dentist are actually rebooking back in. Now there's a few reasons for that. First of all, we warm the water. It's warmed to 40 degrees, so it feels so good and gentle on the teeth. And instead of metal vibrating on teeth, it uses this gentle mix of air, warm water, and a gentle powder. There's hardly any vibrations on teeth, which of course makes it feel more gentle. Patients will tell you how much more gentle the procedure truly is, and you will see how many people will be calling up going, I never want to see any other dental hygienist ever again. I only want to have the air polishing system moving forward, and they'll be referring their friends and family to you. The third reason is it made me more informative. Now, what I mean by that is I was able to provide really good oral health education to my patients through using the systems with air polishing. With every patient, I use disclosing gel at the beginning. It honestly takes about 10 or 20 seconds to do. And then after you wash it off, you quickly show the patient in the mirror where all their bacteria and biofilm is sitting. Really changes the education for them. They actually get so empowered seeing that bacteria. They're like, wow, I need to focus more on my right hand side. I had no idea I was missing my premolars. You know, it's really awesome to see them get motivated. This is a bit like them coming for their hygiene visit and they're checking in to see how they've been doing with their brushing. And they love to see it. Now, don't get me wrong, there are a few patients here and there that are like, oh my gosh, I do not want to see that, do not show me that, which is totally fine. Don't force it upon them. But the ones who do want to see it, they get so much motivation from it. They also find that you're actually doing a really good job removing that bacteria for them, and that you're not just doing a scale and clean, that they can do at home with their toothbrush. They can see what you're doing and they value it that much more. Now, the last point is less fatigue. Using the traditional methods of bacteria removal can be very straining on your body, even when you're trying to do things the correct way. What I found was with this machine, it really takes off the pressure off your hand and wrist. The next part of the video, I'm going to actually show you step by step, super easy, how to actually use air polishing. So I hope you enjoy this video, and if you like it, please subscribe so you can see more of my videos. Step 1 is put some lip balm or Vaseline onto the patient's lips. This is really important for a couple of reasons: for patient comfort, because you're about to put a lip retractor in, and also to make sure that no disclosing gel actually seeps onto the patient's lips. Once you've put that on, we're going to put in the lip retractor. I like to do a bit of a figure of 8 where you squeeze it in the middle and then you tuck it into one corner of the mouth and then you tuck it into the other corner of the mouth and you're done. Now there's a lot of different brands out there, like for example Optragates is the most common one, but then there's some really cool new brands that are actually autoclavable, which I love. I love anything that's environmentally friendly. That's awesome. Next step is putting the disclosing gel on. So with the disclosing gel, I like to use these little pellets, so it's super quick. It takes me like 10 seconds to do. Next, we're going to warm the water. To be efficient, I actually get my dental assistant to start warming the water while I'm putting the disclosing gel on. But otherwise, if you don't have a dental assistant, you can quickly warm the water yourself. All you do is reduce the setting of the power to 0, which means that the powder is not engaged. You're just using water. You press the foot pedal and you just hold the handpiece over the sink or into a cup. Put your finger over the metal part of the tip, so then you can actually feel that the water is getting warm as well. It should turn a nice 40 degrees. Once it's warm, you're now going to wash off the disclosing gel off of the teeth and just use your slow speed suction to just suck up all the water. And now we're ready to start removing the bacteria. So the first thing you're going to do is engage the powder. So to do that, you just increase the power from 0 to either the level 2 or 3. You're now ready to press the foot pedal, and when you do, you're going to see this mist of air, water and powder coming out of the handpiece. While you're removing the bacteria, you always have your slow speed suction going, and when you get to the front teeth, you may want to get a high volume suction out, because that will get more of the water, and it'll also protect you as the clinician from all the water that might be spraying as well. A lot of you might actually ask, is there too much water? Like, is the patient really uncomfortable? And initially, I think you will find that there is more water, but you very quickly adjust and get used to making sure that you get all the water out. When you are ready to do your front teeth, I will usually hook the saliva ejector, so it's at the back. Now, when you do that, make sure that you're not making the patient gag. So make sure that you're tucking it in away from their tongue and not going down their throat. And then you can hold with your non-dominant hand the high-speed suction. I like to get the special tips which are wider, and they're fantastic because they grasp even more of that air, the water and powder out. If you have a dental assistant, of course, they can be doing this for you. I personally work without a dental assistant and I find it works just fine. As I said, the high-speed suction is really more to even protect you from all the water as a clinician rather than for the patient. I pretty much always begin with posterior teeth and I work my way forward, and I'll always do posterior teeth in all the quadrants first. And that's purely for efficiency, because when I'm doing anterior teeth is when I'll usually hook my saliva ejector in the back of the mouth and I'll get the high speed, high volume suction out for the anterior teeth. Now that's not even so much just to get water out, it's actually also to stop water from spraying on me because when you're working on front teeth, quite often the water kind of goes everywhere and it might get you as well. So it's good to have that going. Once you've removed all of the purple gel, you can have a look around and see if there's any hardened calculus left behind. I do find with air polishing, there's very little calculus left behind, but if there is a bit there, it tends to be more in those lower anterior areas or the posterior upper buccal surfaces. That's where the saliva glands are, and so of course that's where the bacteria tends to be thicker. You then have two options. You can either do a bit of hand scaling. I've done YouTube videos on hand scaling before, which I'm sure you've seen on this channel. So I will generally hand scale every time, but you don't have to. Another option you could use is the ultrasonic handpiece, which is on the air polishing system. And remember that you won't need to do the whole mouth with it, only those localized areas where you can really see the calculus. The Woodpecker comes with lots and lots of different tips for the ultrasonic. They're fantastic, they're great tips, and the kit comes with them so you can choose which one you're going to use. Once you've done that, you're ready to take everything off. So super simple. You can now reapply some Vaseline if you want to, just to make them feel even more comfortable. And to finish off, I like to put some tooth mousse on. So we use Tooth Mousse Plus. You probably have other products that you can use as well, but it's just how I was trained and what I like to use because of the calcium and the fluoride. So I'll just usually put some on my finger and I'll rub it around. And that's just to remineralize the surface and just to make sure that the teeth are nice and healthy, and a bit of prevention at the end there. That's pretty much it. It's as simple as that. The instructions I give to the patient afterwards is to not eat or drink at all for half an hour. Also, I advise for 2 hours not to have anything that could potentially stain their teeth. With air polishing, I am able to remove stains so much more effectively in comparison to other methods, because it does tend to get into those really tight, narrow spaces. And with the powder, you can also change to a thicker powder, so one that contains bicarb soda for those really stubborn stains, or you can actually press the foot pedal on the boost button, and the boost button makes the pressure even higher. So with that higher pressure, it removes the stains so effectively. It's honestly incredible. So anyone who's a smoker and has heavy stains, I will always suggest air polishing too, because it just makes our life so much more easy. Now that we've finished, we're just going to now purge the instrument. So up here in the top right corner, we have purge. So we're going to press that. What you feel is this air coming out, and it's getting all that air and powder out of the lines. You can do that a couple of times, and once you've done that, you're ready to wipe it down and change over the room. Also, I must say, I have used a couple of different brands when it comes to air polishing, and the Woodpecker system that I'm currently using is so much easier for me to use. There is a lot less clogging, and even if there is, you can actually take it apart and unclog it yourself. So easy. It is actually such a well thought through machine. I used to get really stressed using other brands. Like, they would clog all the time and I would have to stop, and I'm getting all anxious because my patient is waiting for me. I'm trying to change instruments. It was just a great big mess. But I must say, with this machine, I'm so much more relaxed. I feel like I'm in control. And what I also love is the design of it. The handpieces are made out of this beautiful metal, and the metal itself is so much better than some of the other brands where it's made out of plastic. They used to crack all the time, and they were very expensive to replace. So if you're interested in the machine, reach out to Woodpecker, and you could maybe even organize to have a trial machine brought to your practice so you can give it a go and play around with it. You really have to play around with it to know how it works. I mean, I've shown you how easy it is, but you've just got to play with it. Try it for a few patients and see. I'm pretty sure you'll find that the patients will tell you how much better it is in comparison to the traditional methods of using ultrasonic or Cavitron. But of course, try it for yourself. So that's pretty much the easy, quick steps of how to do air polishing. I hope that you found this video really helpful. If you have any questions, please feel free to reach out to me. Just comment below. And if you haven't already subscribed to our channel, please subscribe so then you know that you can see videos like this in the future. Next, I might even be making other videos in the future. For example, how to do perio treatment with air polishing. Some people are asking about that. If you're interested in that, please comment below, and then I'll know that that's something you're interested in, and I can make a video about that as well. Well, thank you so much for listening, and I hope that you enjoy trialing out that air polishing machine.